This is It's Not In Your Head podcast with Dan and Juz. Dan is a doctor and Justine a pain coach. We've come together to find ways to manage complex chronic pain better for both patients and providers.
Welcome to today's episode of It's Not In Your Head. This is a roll-on from the therapeutic limitations episode. The whole idea is being able to then bring together expectations, understanding limitations of what the medical world can do, and then be able to link them to your goals. And so it's going to take us through how she approaches goal setting and how you execute on that. I'll do my little version of it, which is slightly different, just from a different angle, comes out with the same outcome. But it gives you the option to choose, well, actually, I think this works for me or this works for me. But it's important to be able to have some goals. So, Juz, importance of goals. Tell me about them.
What about goals? Yeah, goal setting it's interesting. And it was funny when Dan and I were sort of talking about this in preparation for the episode, because the way that I kind of think about goal setting and how I approach it and talk about it in my work with patients is a little bit more from a mindset perspective than the actual framework and then strategy that we'll get into for how you can literally break things down in front of you on a piece of paper. But just from the perspective of, why does your why really, as much as your goals, which those things are, to me, largely synonymous, but your why, why do you want to improve your pain and why do you want to change that, has to be relatively meaningful and deep, because this is hard. And when I start with patients, that's one of the things that we want to be on the same page about, is that this is difficult. This does take a long time. And when your goals thus are kind of shallow, which are not necessarily wrong or bad, it's not wrong to want to look like you used to look like, right? Or to want to lose weight and those types of things. But typically, those aren't the really meaningful things about ourselves that we lost or want to get back. It may be how we see ourselves or our sense of self, but when it's more connected to like your purpose in the world or your role or your fulfillment or the quality of time that you want to be able to spend with people you love. Like I have a great example is one client was like, she wants to be able to play with her grandchild more often, right? Instead of being stuck in bed all the time. That's way better than someone who wants to lose 30 pounds to me. There's nothing wrong with
I've got a great story around that. I've got a great story.
Nice.
So I was like, oh my God, this is the greatest goal ever. So I had a patient when it was at a period of time when for disclosure, I have shares and have helped develop a stem cell product for osteoarthritis. And it was during this period of time where we were doing studies, and which are still ongoing. But anyway, nonetheless, this guy comes in and he's got arthritis in his knee and he's young. I said, what's your goal? What do you want to achieve? And he goes, I want to be able to play soccer with my unborn child. And I was like, oh my God, greatest goal ever. Probably,
that's good.
It was probably 10 or 12 years ago now. And at that point in time, my kids were really young. And I was like, oh my God, I understand where you're at. Anyway, it was a great goal. The other thing I was thinking about as you were talking is you said one thing, that it takes time. And I think that's like when people come in to see us, like it is like, please take this away now.
Fix me now. Yeah.
And like, I always ask that question. So what is it that you want me to do for you today? Because what I'm trying to tease out is like, where's their expectation at? Like, what do they want? And we'll talk a little bit more about this at the end. But like when people say, I want you to take my pain away, like I have to go, well, I can't. Like, that's not going to be like, I want to, but the likelihood I'm going to be able to take away 100% of your pain is close to zero. So let's bring it to something that I can do for you so that like at the end of this, you don't hate me and you've actually achieved, what you actually want to achieve. So anyway.
Yeah. And actually that's a really good point too, because I also talk to people a lot about, and I do this even on a consult before we even start working together. I ask them, where do you see yourself, in 1 month, in 3 months, or a year from now? Because to Dan's point, you can't take all your pain away when you walk into your doctor's office. He can do some part of it, but then the more long-term, decrease in pain or decrease in other symptoms ancillary to the ouch part or the interventive piece that Dan can address does take time, especially with central sensitization and diseases like complex regional pain syndrome and things like that. It took a long time for your nervous system to get in this position, and it's going to take, time to get out. It reminds me sort of like compensations from a, muscular myofascial perspective. It took yourself time to dig yourself into that pattern that keeps your glutes from engaging and isn't incorporating your multifidus the way you'd want to. Well, it's probably not going to take 1 week to dig yourself out of a pattern that you've been doing for months or years. So chronic pain in some cases is similar. In some cases, you can treat it quickly, right? If you can find the driver and there isn't this amplification and positive feedback loops developing, you can get more of that kind of instant gratification piece of things. But that's why for most people and in most cases, the goal being meaningful matters because it does take time. And if it was quick, it wouldn't matter that it is as significant to you.
From the expectations around like the simpler stuff and the smaller stuff, I suppose, like managing my fascial pain, how do you tie purpose, which is obviously the bigger driver for many people, into, creating a plan and like fitting it to, okay, I've got this purpose, my plan then needs to look like this, which is then going to be different to everybody else?
Right. It's such a good question because when you think about why do people struggle with plans also or difficulty following through, oftentimes it gets blamed on motivation issues, right? Or lack of discipline. I don't really find that to be the case. I think when people struggle with their habits, it's because the habits that they're trying to implement are not or haven't been connected to them to their purpose. So your why, your goals, your purpose, plus your plan equals discipline. So if your purpose and your plan is tied together, it creates intrinsic motivation because when you wake up in the morning, why I want to eat right or hydrate myself enough and move and manage stress and have accountability for my recovery is connected to my longer term, larger goals. When it's not, those things don't matter and they're not meaningful enough because the amount of pain and symptoms you're in is screaming at you louder. So from a sustainability perspective, it also matters a lot long term.
I love discipline as a means of
discipline is Dan's favorite thing.
It is like the best. The thing with me, like I got bits that hurt more than usual, but I don't have chronic pain. And I love the discipline piece. And I think there's things around discipline that I do for my day-to-day things that mean that I get other stuff done. So it comes down, it's simple as like doing things like some of the things I do, like I shave my head every day.
Me
and
too.
That seems like a simple thing, but it's kind of like the same as like I shave every day. And so it just becomes, from a discipline perspective, what I'm going to do is I'm going to do this, this, and this. And it starts the day in exactly the same way. Like other discipline pieces, which also become easy stuff. So I just use like the black polo. Like it's easy, but it's also
Right.
discipline. Like it is, it's doing the same things all the time, which then means I can get more disciplined around the other things in my life that I need to get done. But I sort of set those very simple things that start a day rather than try and be disciplined around absolutely everything.
Like working out, being disciplined around larger things. And I actually think that's a really good example because once you can start to develop discipline around something that you've wanted to do but haven't, you're showing yourself you love yourself and you care about yourself, right? And you care about your goals. So from a morning perspective, having a morning routine can be really helpful for people with chronic pain, not just because they're distracted and, you're starting your day off not focusing on how you feel necessarily and setting yourself up from a stress mindset perspective, but for the same reasons Dan, as someone without extreme chronic pain, also benefits from. And when you have these additional challenges, not doing stuff like this doesn't make it easier. It makes it even harder. And then you can start to change the way that you think about yourself, the way that you feel about yourself, and in a lot of cases, the way that patients talk to themselves, like think about themselves verbally. Because it's often very negative because people's, sense of self has changed a lot and they have so much shame around their habits and who they've become, basically.
Yeah, let's be honest. The person in probably everybody's head is pretty mean. We should do a podcast on like the evil guy or person or, non-binary individual that is in your head that says stuff to you that you would never say to anybody else. Like, that is horrendous. Anyway, one thing just on the discipline thing, the other thing that I like about discipline and what I use it for, everybody, if you need to wiggle, Justine's wiggling to get onto the like ouchy bits. But the thing that I like about discipline as well is that if I'm heading off the rails, the first thing that goes is I will, you know what? It's normally I forget to shave my head, and I'll be like, and I'll forget, and then it'll be the next day, and I'll go, oh, hang on, what's going on?
It's an
Seems a bit
early
wrong.
indicator. Yeah, it's an
It's an
early
early
indicator.
indicator. It's an early indicator that like
Yeah.
brain is going off the tracks. Pull it
Yeah.
back, which is, it highlights a little bit how crazy I am at times. But
No,
nonetheless, I use it as a marker of where things are going. And so,
not
anyway,
crazy. No, this is good awareness because this is super important for someone in chronic pain, for example. Before you've let 87 habits fall by the wayside, it's better to catch it early because we all do this. I too slip away from the things that I know I need to do and help me. And there's a lot of steps before I haven't worked out for 2 weeks, right?
yeah.
So that's actually a really, really good observation.
How do you then, like, what's your technique by which you're then connecting discipline to habits to motivation?
Well, it's through the education process to a degree in and of itself. When people understand, you have to understand why do these habits impact, for example, in this context, my pain output, which is what is the barrier between me achieving these things that I want to do or the roles in life that I used to have. So that's why people don't create certain changes. I think in a lot of cases, they don't feel why it would be so impactful. And if you don't feel that, it's very hard to care about something and then to have discipline around it. So I think oftentimes a lack of discipline is an understanding education, knowledge piece, and then connecting it through conversation and support long term as people try to actually implement the habits that they know as far as information. Okay, everyone knows they need to, eat healthier, maintain connection, blah, blah, blah. Nobody knows how to do it with a ton of pain and with all these other barriers. And one thing it kind of reminds me of, it's a quote that's like, I'm going to butcher it, but growth happens on the continuum of challenge versus support. And from a coaching perspective, I think that's really good because you need to support people enough, but you need to challenge them enough, right? And that's
Nice. I
a
like
piece
that.
that ties into that understanding education for me.
All right. So, how do you break it down? So, what are you going to do? Like, how do you take people through their either setting their goals? Like, what time frames do you do it over? How do you identify what they are, et
Yeah.
cetera, et cetera?
Timeframes is a good place, like I talked about a little bit earlier, as far as short term versus longer term. Some things you can impact quickly. Some things are going to take longer to impact. So just like with other things, what's a kind of a combination of the lowest hanging fruit and the most impactful? That's why sleep habits, right, are up there. Fueling is up there. Stress management, those types of things. And these vary person to person as far as what interventions or things would you choose to help facilitate their goals. But I think from a movement perspective in particular, that's a skewed bucket as far as what are your goals and what are we doing to get there? Because it depends on what someone wants to achieve physically. A lot of times what we're going to do as far as the movement program or how that's going to support them and what types of movement would they want to work up to, as opposed to a lot of the other things. They're almost non-negotiables a bit as far as it has to be a goal to want to improve your recovery or else your pain isn't going to get better. So what we need to do is have you understand why that affects the output and then list it. So we'll kind of go through a good framework. I actually like the way that you take people through it without it being under each little umbrella, but just within their entire life context. What would they want to keep? What would they want to get rid of? Because it's pretty easy to define once we go through an intake what we need to do under each aspect of care and tying that to their purpose. It's like Maslow's hierarchy of needs. You can't get to fulfillment, purpose, meaning without safety, security, shelter. So it's a combination of we have to do the stuff on the ground, the day-to-day, micro things to then take care of the bigger picture and get to that bigger picture.
So, take us through how you would lead people through a process to identify purpose, the stuff that means something to them, that's important to them, that they can then link into the discipline piece.
Yeah. So there's actually a worksheet kind of in the mindfulness bucket of stuff that I'll take people through that's adapted from someone called Kelly Wilson's Valued Living Questionnaire. And it's this form sort of, but we go through it conversationally so that people can actually, if they want, jot it down on their own, but then go through it with me. And the different buckets that we'll touch on are things like family relations, marriage, couples, intimate relations, parenting, friendships, social life, career, employment, education, personal growth and development, recreation, fun, leisure, spirituality, citizenship, environment, community life, health, physical well-being, right? So these are basically different buckets of life that are going to vary person to person as far as what are priorities to them. Some people, family relations are going to be a big deal. Other people, it's their career, right? Other people, it's their own fulfillment before romantic relationships. But actually looking at this stuff and writing it down and then thinking about it oftentimes helps people get back in touch with parts of themselves that they've either lost and then use that as motivation. But if you don't even identify what you're missing and of those things, what's most important to you, it's really difficult because you also can't get everything back always. Again, some things that you can work on and improve are going to be shorter term compared to longer term stuff. But these are the things that then I want to tie from this is meaningful for somebody to then these are the behaviors that we do to get there, right? So if it's stuff around my family relations, this might even involve like, how do you communicate about your pain or your illness? Or how do you become more present instead of being as distracted and self-centered in certain ways because of what you're dealing with? So based upon which one of these buckets are more important to people, that's kind of what we're going to build and prioritize the program around and ideally give them more skills to get back to.
I really like that. I
Like
actually
that?
really like the
Really?
two pieces I really like that. I really like that reflection then on you linking the distraction of the pain to how you then interact socially with relationships. Because most people what they lose, you lose stuff, and we'll talk like my take on this relatively soon, but
Yeah.
one of the things that people lose is that they lose relationships, they lose their position in the family, and they
Yeah.
lose like you lose work and you lose like your role at work because you just
Right.
can't do it. And I hadn't thought about how that links to I'm distracted by my pain because this thing hurts so bloody much. So then I can't interact with you
Right. I'm
because
not who I used
my
to
brain is
be.
overwhelmed.
Right.
And
Right.
I really like that. I like that as then you've then got a set of techniques you're going to put in place to manage that distraction to then be able to fix your relationships.
Right.
Ooh, that's cool.
Yeah.
So good.
Well, and it like this helps also how you again see yourself because it's not that you suck or you're a bad person or you're suddenly not a good family member, right? But it's just acknowledging like, man, I have changed in ways and what can I do about that? Because not everything can you get back. Sometimes that's the really hard truth. Like maybe you love surfing, maybe you can't surf in the way or be active in the way that you used to be, then you definitely have to work. You have to work even harder then to kind of pivot and to create other things that are meaningful, other things that are worth it. So to me, that's really what it comes down to is there have to be enough things that are worth it for you to put in the effort and to persevere through all the challenges and it being easier not to, because it is easier not to, but then you don't improve these things. So
We've talked about that piece before, and there's different styles or different attitudes patients bring in, and it's come from their background. Like we were talking about, so I'm a sports physician. So when I was doing lots of sports medicine, the people who come in, they're like highly motivated. They're like, it's not because what they've got that hurts is stopping them from going to work or stopping them doing that. It's stopping them from running a marathon or it's stopping
right.
them from like climbing a mountain that they like, I have to go climb that mountain.
I
So
have to
like
that.
it is like they're a different set of beasts. What I really like, and interestingly as well, I look after a lot of like special forces guys. I don't know how. I must be on a list somewhere
Probably.
where the Australian special forces guys go see this guy. But what's really interesting with dealing with them is that even though they may have horrendous pain and most of them have got like they don't have one thing that hurts, they got tons of stuff that hurt.
Yeah.
You can tap into that mindset. Like the
Athlete mindset.
special forces guys are elite athletes. Have no doubt about it. They just are elite at doing other stuff, not running around in circles. They doing lots of stuff. So they're elite athletes and you can tap into that mindset and you don't have to dig deep. It's
Yeah.
always there in them.
on the
And it's
surface.
and like you scratch the surface and you go, dude, you remember all this stuff? You remember everything
Yeah,
that drives you? Remember that thing that took you to do amazing stuff? Great. We need to tap
use
that
that.
and we're going to use
Use that.
that to dig you
Yeah,
out of this hole. Ah, love it. Like
yeah,
it is the best. It's that desire to make the effort and the ability to make the effort to get what you want. Like to link
right.
that in. Because at the end of the day, you and I can like point people in the right direction and we can
Yeah,
go, okay, I've got a magic trick here that we can block this pain for a while and that will get you this step forward. But the patient's the one who's got to run at it, walk at it
yeah,
slowly, do whatever. But you got to, yeah, it's got
yeah.
to be them.
And it reminds me of something I also ask people as we go through our initial intake is what other experiences in your life have given you confidence and shown you that you have done things that you set out to do, despite them being hard. That can be, I'm a badass mom and I never wanted to have kids or I wasn't sure, right? You can actually, something I talk about is borrowing confidence from other parts of your life. So maybe, moving in chronic pain is new to you and scary and you don't feel confident. That's cool. Pick something that you're confident about and remind yourself, like, oh shit, I did do that thing, in the past. And that is still a part of who I am. And just like Dan's saying, tap into that, use that. And if you're like a type A, super athlete, perfectionist, go, go, go. All right, we might have to like tweak it a little bit so that we manage your stress a little better, but use that. You know who's most successful with complex regional pain syndrome? That type of personality very often. It just initially causes a lot of problems because it also amplifies pain because it's very hard for us to pace and, like it feels like acceptance is resignation, like that type of stuff. But when you actually use that to your advantage and in the right ways, it's very, very powerful and impactful long term because it affects people's behaviors over time. So I really like that.
I like that as well. I like it from a parenting perspective as well, because like, so here we go, insight into Dan's crazy parenting style. So I think what you're referring to there is that you're referring to a period of time where you had a significant amount of resilience, and right at this point in time, your resilience is down. That's
Right.
like the
Yeah.
upshot. Like the resilience is down at the moment. And so, like, I think about it like with my kids, how can I build that into my kids?
Yeah.
I'm a doctor.
Yeah.
My kids are very privileged. I am lucky in that they actually understand that. So that's like amazing in itself. But
I'm
they also
biased.
don't
Dan has
like,
great kids.
but from day to day, there's nothing that really challenges them. And like they don't have to dig deep. So
Right.
what I've done with two of my kids so far is when they were both young, one when they just turned 11,
Oh my
and
God, I know what you're
the
going
other
to tell.
child when it
Don't
was base camp.
scare our whole audience away, Dan.
Yeah, no. We walked Everett's base camp, and the reason why I chose that is because number one, it's
Oh,
hard, but it's really safe. And we'll tell the story at some time. But
and
they both had their challenges at that time, and
uh,
they both came back, and they get that they can do something that's hard.
they can do hard things. That's a motto
They
that I say
do
too. We
hard
can do
stuff.
hard things.
Yeah.
Yes.
And
Yeah.
and that's what I wanted to give them in with that experience. You got to know that you can actually do stuff that's hard. Yeah. And if like the special forces guys have got that, they don't have to think back very far to find
Yeah.
out, to remember when they did stuff that is hard. And if
Right.
patients can then go, you know what, I have done stuff that's hard. More recently, I have a patient that they have, I'm going to call it brittle. Let's call it brittle neuropathic pain. And what happens for them is that they can have a period of time where their pain is horrendous and they are stuck in the house, unable to do anything. And then over time, it calms itself back down. And when I say over time, I'm talking 6 months. And then they have a period of time when it's good. And then what will happen again is that they'll do something, and it's always something simple. It'll be walking up a set of stairs, it'll be picking up some washing,
Right.
picking up and it
Yeah.
triggers it off again. And then they're in excruciating pain again for another 6 months. And so we had a discussion the other day about me just saying, look, dude, you do realize that you live a very courageous life. Like at that time, we were talking about pain behaviors and how he does a whole stack of stuff to minimize
To
him
manage.
triggering their pain. And they were reflecting on it as this stuff is crazy. I'm like, okay, there is some behaviors there that like are not 100% normal. But the flip side is they live a life that you do one thing and they're in excruciating pain for 6 months. To actually get out and do anything, you got to be super brave. Like that, like, and he was saying how scared he was. And mate, you can't be brave without being scared.
Being
Like
scared,
they
yeah.
go together. Like it's
Yeah, the
part of the
fear.
deal. And just reflecting on that, and even if, like, at this point in time in life, patients can't look back to their childhood, their years previously, where they go, you know what, I was resilient then. Well, you can just look back yesterday and see what you actually got out and did yesterday. Because
Yeah.
if you're scared because it's going to hurt, well, when you go out and do something, you're being brave. And that's a life that I don't have to think about. I can just get up
Yeah.
and go, and I'll go to boxing and do whatever else, and I don't suffer the consequences. And so if you're able to do that, like, good work. You don't have to look back to a childhood. You just look to yesterday.
Yeah. No, that's perfectly put. And I think that's why, even though the people I work with, right, look up to me as like further along and an example of what they can achieve and inspirational, although I don't love that word, I find the people I work with inspirational, and they inspire me because I find them so brave too. Just like Dan was saying, and to do things and to still try and to be vulnerable, and to be willing to look at like the not great bits of yourself that are not even necessarily your fault, can be painful, right? And that piece too takes so much bravery. Like, to do the work that it takes to improve pain is very rarely just physical. And I think that's probably even the bravest piece of it for a lot of people. And when you think about what maintains chronic pain, in a lot of people, it's that piece of stuff and the ways that we've learned to cope with things because it's the best we could do and it serves us until it doesn't anymore. And then to change that isn't easy. It's hard the older you get. So I really appreciate, you bring that up, Dan, and hearing, people who don't live with this say that also means a lot to me. And I guarantee it means a lot to our listeners too, because we don't get called brave a lot. We get told it's in your head and told, and it makes you feel not brave.
No, it's not in your head. To juxtapose this, I do things slightly differently. So, and as you know, my experience when patients come and see me is what they're coming to see me for. And they're not coming in to say, Dan, I want to climb a mountain or I want to do base camp. Like they don't, like, those patients don't come see me anymore. What they come in about is about what they've lost. And so pain most of the time is about loss. It's about the people you've lost, things you can't do anymore, work,
Right.
finances, sense of self. And so the way I take, it's another way of approaching, wiggle, everybody, wiggle if you need to wiggle. Justine's
Our
wiggling.
recording time is in a rough window for me. So that's why you guys are always going to see me pretty much squirming like this. It's normal. Don't worry.
So one way is to go from a losses perspective. And what I get patients to do is sit down and write down all the stuff you've lost. So write down the things that you want to do that you can't do. Write down all the people that you've lost in your life that don't talk to you anymore. Just write down absolutely everything that you've lost. A bit of a sad list, but
I was
nonetheless.
going to say, this is where the grief comes out, but it's for a reason. Don't worry.
Yeah. Then what you do is you go through the list and you cross off everything you don't want back.
I
All right.
love this
So
part. I
yeah,
love
so
this
that's
part.
actually a useful. Actually, I can't do
Yeah.
that, and I really hated doing that. And
I don't
that
want that
person
back.
hasn't talked to me for like 2 years, and I didn't like him anyway. Scrub. So like you can just like do a clear out, like do
Yeah.
an emotional clear out of all that stuff, and then come down to what are the things that you've lost that you would like to get back. The piece after that is, and then you've got to rejig it into two lists. Okay, the first list is from easiest to hardest. So look at it and then go, okay, that one's, I want to be able to do the shopping. I want to be able to do this. I want to be able to help with doing the dishes around the house, that sort of stuff. No problems. Boom, boom, boom. Put them, that goes at the start. I want to be able to like run 10K. Okay, let's put that at the bottom. Or I want to get back to work and my work requires me to dig trenches. Okay, that's solid. So go from easiest to hardest. Then what you want to do is you want to do a second list and go from least important to most important. So what you start with these is you then start at the easiest and you finish at most important. And the other thing you can do is you can take these, create like an arbitrary line. So for your top 10 important things, that becomes your arbitrary line. And you can then do like a 2x2 square where you then link easiest and important with, least important and hardest. And of course, you start with the easy important stuff and you then work your way through. And so understanding that sort of stuff then gives you a structure which you can then go and talk to somebody. And so how do you talk to your doctor, and
Right.
what expectations do you talk to them about?
It was perfect because really, I mean, it's one thing if you're working with me, but if you're not working with me, how are you communicating with your provider about your goal setting? So that's kind of the last piece that we want to talk about in this episode is what do you actually do with the options we've given you to work?
Yeah, I'll give my one example. And so my one example is like, let's say that you, as Jazz pointed out before, you want to be able to play with the grandkids more. Like that's a really common thing. So what I try and do with my patients is we send them to our exercise physiologist, which is kind of like a physical therapist, but they just more focus on exercise based. And then if your goal is, I want to be able to play with the grandkids more, what does that mean you're going to be able to do? Okay. So it means that, let's say that they're 3 or 4 years old, how much are they going to weigh? Okay. So they're going to be about 15 kilograms. So you need to be able to build yourself so you can do something like a goblet squat of about 15 kilograms. That's going to allow you to pick them up. What else do you need to be able to do? You need to be able to get down on the ground. Okay.
The perfect example to use is like how you tie it to someone's goals because it's so clear.
Yeah. And then, but what else do you need to do? You need to be able to get off the ground. Like you can't get down and stay there. Like the 3-year-old's not going to be able to help you get up. So like those things then tie very directly into movement, strength, as about, okay, I want to be able to do these things so I can do this with my kids.
Yeah. And if someone didn't care about movement before, but they do care about playing with their grandkid, that's how Dan can go, well, to do that, right, you got to be able to do these things. And then it's easier to care about that when you see the connection to, if I want that, I have to climb these steps, really. It's different too, right? With stuff that you can address in one visit versus this is going to take us a number of treatments or a certain amount of various interventions maybe to get to. So you often talk about like, what can I do for you today, for example, also, right?
Yeah. So thanks for the leading question. All right. So one of the things I always do is I will ask 2 different questions for patients. I ask, number one, what do they think is the problem? Okay. So what do you think is causing this? And it's interesting to get different answers. Some people will say, oh, I think it's this structure. It's my L45 disc. Other people will say, you know what? I think it's because for my entire life, I've worked really hard and I've just worn myself out. It becomes like the answer is different depending on what people give. But the reason why I ask it is like I will, by the time we get to wherever, I'll have an idea of what I think this is. And I'm trying to gauge, where do I need to take this person? Are they on the money? Right. Or are they somewhere over here and I've got to bring them to where I am? That's difficult at times. The other thing that I then ask, which is the follow-up question to that, is what do you need me to do for you today before you leave? Because the answer to that will be different. And this is sort of how, like, this is what you need to go in when you see a doctor, particularly someone like me. You need to go in with what you need from them. And so a lot of patients will just come in and go, I just need a diagnosis. I'm like, great, no worries. We can go through that process. I need a plan. Great. Because I'm going to give them both probably a likely diagnosis. That's the least thing you're going to leave with, like, if you see me.
It's true. I've seen Dan's notes. It's true. It's true.
The other thing that people actually will come for, that if I don't ask, they'll go, you know what, actually, I'm going on a holiday in 3 weeks. I'd really like to be pain free. Okay. Okay, you've had 10 years of pain. You're going on a holiday in 3 weeks. You want to be pain free. Okay. My strategy now is going to be very different. And sure, like I'm going to go to the holiday program. No problems. You got a holiday coming? We'll do the holiday program. The holiday program will possibly decrease your pain for 2 to 3 weeks. Then it's all going to come back.
Right. Temporary.
And then we're going to actually have to work out what's going on. Rather than starting at, okay, let's find out what the diagnosis is and we'll create a plan to sort of build forward. The holiday program. But if you don't tell us, and most people, they don't tell me that, hey, I've got the holiday coming up or I've got my my daughter's wedding.
Got
I want to be able to dance at a wedding. That's like really common.
Oh.
And so if you don't tell us, people leave frustrated. He didn't address what I wanted to address.
Right.
Okay. You've got to go and clearly in your mind what it is that you want from the doctor, because then they're going to actually be able to give it to you. Because we have got strategies for doing stuff that's short term, we've got stuff to doing stuff that's long term, and we got to meet it to what you need like at that time. It's important that you know. The other one thing I was going to say is if you come in with and you got tons of pain, one really good trick. So if you come in and say, I've got pain all over my body, I'm going to tell you now, I'm not going to work that out like there and then. What do you need? If you go into it to see a doctor and you say, okay, here's the deal. I've got pain in tons of places, but the thing that bugs me the most is my right whatever, okay? If you can tell them that, what's going to happen is it'll clarify for the doctor what they need to focus on, clarify the history taking component, it'll clarify the plan, and you're then going to leave with someone focusing on the exact thing that bugs you the most. They get on top of that, then you can come back and go, you know what? That thing doesn't hurt so much anymore. Now, can you like sort my left shoulder? You do it in that way, okay. That is a way to then like tie your goals with your expectations, with how you're going to interact with doctors, clinicians, blah, 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 to actually be able to then achieve your goal.
Yep. No, that's humongous. And all of that ties into expectation management too, right? Given the situation, given the context, given what the doctor can do in one visit, what can we do? And having a collaborative approach to that, again, that's in line with what the patient wants. This comes back to our previous episode on even the limitations, is really valuable. And I think as patients, we often expect and think that the doctor should be able to pull this out of us and they should know what we want. And obviously we want to be in less pain, but the more complex your picture becomes, the harder it is for the physician to also know that, and nobody can read your mind. And it definitely helps make a situation where you're already short on time too, right? The doctors, they're distracted as well. There's a lot of patients. And so the more organized and streamlined you can come in there, the better visit you can get. And then no one's miscommunicating and developing resentment and frustration towards the other when really it was just a lack of communication. So I think going in with a bullet point list is a good basic skill.
Yeah. Link the bullet points to your goals.
Yeah.
Perfect.
Beautiful.
Alrighty. And I think that the finish off, Justine just referenced how confusing patients are. And I think that
we don't mean to be, but we can be.
Yeah, I know. But I think that what I wanted to say is that what we're trying to do in the web in this podcast is decrease the confusion. Patients become confusing because they get centrally sensitized and they get a whole stack of different symptoms that are really hard to tease out. And so hopefully what people get out of this podcast is how to simplify the confusion. And so I already said I like discipline. So we just need a structure to simplify the confusion. And I hope that's what you can all get out of this as you work your way through it. All right.
Great.
Wrap it up.
Thanks a lot.
Thanks, Jazz. See ya.
Thanks, Dan.
Thanks for listening. Clearly, this is a podcast. It's for informational purposes. It's not a consult, medical advice, or the practice of medicine, and it doesn't form a therapeutic relationship. If you feel the information might be useful for your situation, before applying it to yourself or others, you should speak with your doctor or your treating clinician. Do not delay in seeking a diagnosis or treatment, and applying the information is at the listener's own risk.